Can COVID-19 affect pregnant women differently? Do they need to take extra precautions? My colleague Anila Kurian spoke to Bengaluru-based Dr. Prathima Reddy on what needs to be done.
Hi, this is Anila here. I have Dr. Prathima Reddy, senior obstetrician and gynecologist. Doctor, can you tell us, are pregnant women at higher risk of contracting COVID-19?
COVID-19 is still a very new disease and, as you all know, has been around only for a few months. So the information that we have on this disease is evolving and growing. However, what we do know, at least till now, is that pregnant women don't seem to be at a higher risk of contracting the COVID-19 disease, which means your chances as a pregnant woman of contracting this disease is the same as anybody else of your age. The good news also seems to be that pregnant women who contract this disease don't seem to have more severe symptoms, nor do they become more seriously unwell as compared to anybody else. In the past, we have known that pregnant women who develop viral diseases, such as say H1N1 or swine flu, seem to do worse than others. But in the present COVID scenario, this doesn't seem to be true.
What should they do if they experience symptoms or have been around somebody who has been tested positive?
If you have experienced any fever, cough, cold, diarrhea, extreme tiredness and body ache, contact the nearest fever clinic or the flu clinic. Remember that not every hospital has been authorized to run a fever clinic. There are certain hospitals only that run these clinics. Please contact these clinics and they will be able to help you as to how to take this forward. If you have been with someone who has tested positive, again, ring up the helpline and the helpline will help you as to how to deal with this.
And can the virus be passed on to the baby?
One of the concerns that pregnant women have is, could they pass the virus on to their babies? Now, we don't have much information about this. And most of the evidence that has come out from China has said that babies perhaps do not catch this infection through their mothers. However, a small number of babies have been diagnosed with the coronavirus shortly after birth, but whether they have caught it after birth or while they were in the womb is still unclear.
Is breastfeeding safe if the mother has been tested positive?
So far, the virus has not been found in the breast milk, but there still is not enough information as to whether women who are sick can pass on the virus to the baby through breast milk. So the best way forward is to discuss breastfeeding with your own doctor so that they can make a decision along with you.
What about giving birth at hospital? Is that a safe option at the moment? Should women consider home births instead?
Because of the current COVID-19 scenario, a lot of women are asking whether it would be safer delivering at home, given that there may be other people in the hospital who may be infected with the virus. Remember, the hospital is still the safest place to deliver because during delivery, there may be sudden changes in the mother or the baby that may require immediate delivery. And this can be done only when in a hospital. So the answer to that is yes, it is safe to deliver in a hospital. Certainly go ahead.
Is it safe to continue going for routine checkups until the delivery, or are there any other alternatives that they can look into at this time?
In order to deal with the current pandemic, we have started teleconsultations, both audio and video consultations with our patients. So the way it works these days is women who have to come in for essential monitoring scans and blood tests are asked to visit the hospital. We restrict the number of women we see per day and also space out their appointments so that there is no point in time where there is a crowd of women together. We also restrict the attenders that come in with them by and large so that we restrict the spread of the disease and the virus. The other patients we encourage to log on to their systems in order to have a tele audio video consultation with us.
Is there any increased risk of miscarriage if a mother has been tested positive?
Again, as I've said in the past, this is a new disease. So the answer to is there an increased risk of miscarriage is we do not really know. However, of the evidence that we have in the limited number of pregnant women, there were small numbers that seemed to have an increased risk of preterm deliveries.
And lastly, are there any extra precautions that an expecting mother should take at this time?
Pregnant women need to take the same precautions as anybody else in this time of the corona pandemic. And these would include washing hands frequently with soap and water for at least 20 seconds. There are good videos put out by the WHO and the CDC, and I would advise you to watch that so that you know how to do this properly. Cleaning hands with a sanitizer, if you can't wash them, is advised. However, soap and water still remains the best. Social distancing is extremely important. Make sure that you're staying away from other people by a distance of at least 6 feet if you need to go out. We would also advise you to stay at home as much as possible. And if you had to go out, to wear a clean cloth mask. Avoid touching your eyes, nose and mouth, and also avoid people who are sick.
Thank you for your time, Doctor.
That's it in today's episode of Pandemic Podcast. If you enjoyed this episode, do rate and review us on Apple Podcasts. Follow us on Apple Podcasts, Google Podcasts, Spotify, and many other of your favorite podcast platforms. Do share this podcast with your friends, family, and on social media. For latest updates on COVID-19 and other news, log on to www.deccanherald.com. Follow our social media handles on Twitter, Facebook, Instagram, and YouTube. Check out our e-paper, www.deccanheraldepaper.com. To be updated on the go, follow our Telegram channel t.me/DeccanHeraldNews for instant updates. And don't forget to subscribe to this podcast. Take care, stay safe, stay indoors.